I got to the point where I could like write occasional speeches, and we were working for a member of Congress, and the political consultant I overheard saying to the member of Congress, "I know they're calling you a liar. We have 3 times as much money. We will call him a liar 3 times for every 1 time he calls you a liar, and we're going to win the election." And at that point, I stayed at DC General Hospital. Anyway, I wound up going to medical school, but increasingly thinking about health policy and public health. When I finished my war, just an incredible member of Congress who just did so many things in environmental health, HIV, access to health care, pretty much anything having to do with public health, and I got to work on all those different issues. And it was like a enormous immersion course for me with amazing teachers who'd been on the staff for a long time. So that's really when I kind of got hooked. And at that point, I was commuting down from Baltimore to work in DC, and the job of health commissioner opened up in Baltimore. And I told Congressman Waxman that I was going to apply for a job I didn't want and I wouldn't get, just to learn a little more about what public health was actually like in practice. And he said to me, we'll see about that. And I wound up getting the job, and it obviously changed my career quite a bit. Public health is just amazing because you wake up in the morning and you look around your community and you're like, I want this community to be healthier. What can I do today? It's just an amazing relationship that you have. And I got to know it like every corner of Baltimore, so many different interesting angles of it. Same, I worked in Maryland. It's just, it's a real privilege to be able to do that.
Yeah, I think that policy angle is really interesting and something that I hadn't thought about when I started the degree. So I'd love to hear more about how you see the role of policy in public health. And I know I took a class and you had done a guest lecture and you told a great story about a Taekwondo situation. I think it was Taekwondo with when you were working for Congressman Waxman. So I'd love to know more sort of about how those little stories can evolve into a policy.
Sure. So it's a good example. There was a point in time when U.S. Taekwondo changed its rules. It used to be that for kids, if they knocked their opponent unconscious, they would lose the match. So it was kind of, disincentivized. But then they changed the rule that if you knocked the opponent unconscious, you would get points or something. It basically like blows to the head were points. I don't remember all the details now. And I was just going through the mail at home, and since I'm a pediatrician, I read the pediatric news, and there was an article in the pediatric news by the sports committee to the American Academy of Pediatrics, and they said, this is really bad, and all these kids are getting, brain injuries, and there's, nothing that can be done. And, I was like, well, I work for a member of Congress, maybe there's something I can do. It seems like a solvable problem. They should change the rules back. Mm-hmm. And so I went into the office, we had a staff meeting, and I said, here's this problem. Anyone have any ideas? And one of the other people on the staff said, well, why don't you get the 2 members of Congress who are Taekwondo black belts to write a letter objecting to this, because Congress charters the Olympic Committee, which gives the designation to the U.S. Taekwondo. So there's like a relationship, and if you got those 2 people, then maybe they would change their mind. And I said, well, who are those 2 people? And she said something to the effect of like, wouldn't you like to know? So it took me a little while to get it out of her, but turns out to be Jesse Jackson Jr. and James Jeffords. I remember because of all the J's. And so we wrote letters, and basically they reversed themselves. And it was an example to me because even like the most informed doctors didn't know what it would take to change something. And yet there is a world where things can be changed. You can change local policy, state policy, federal policy. It's a really important way to make people healthier.
Well, and it sort of gets to that idea of what's the tagline of the school? It's saving lives millions at a time, right? The idea, and that's how I think about the public library too, is like you said, we're touching every part of our community. Whether or not they use the library, our intention is to think about every part of the community. And I think that's also to the point of public health isn't one thing, it's all things, right? So when I applied for the school, the initiative has sort of 5 focus areas. And as I was looking at those focus areas, I thought, libraries touch upon all these, but I was wondering how they were selected for the initiative, how you guys selected those focus areas, and what your thoughts are about how they interact.
Sure, and this, I'll just say a little bit about the Bloomberg American
Yeah.
Health Initiative, and also just mention that we offer 60 or so full scholarships a year to people who are doing great, interesting work like you are, and every year, so if anybody's watching this or here might be interested, you can check it out at americanhealth.jhu.edu. So basically this all came about on the 100th anniversary of public health, which is the oldest, biggest school public health in the world. And it was started, as it turns out, right around the time of the great influenza pandemic. And over the first 100 years, people who passed through there were responsible for the mission, and here we were at the 100th anniversary of the school, which the first century, but what are the kinds of challenges public health has to take on in the second century? The field of public health is not, as it kind of currently exists, is not that old. I mean, we were the first school from 1916. So what are the kinds of challenges? And you think, well, what's really hurting health in the United States? Why is health in the United States so poor compared to other countries of similar income? We're, somewhere in the 40s for life expectancy, if you by rank. It's really incredible, and we spend so much on healthcare. Like, what's going on? What are those issues? And we went back and forth, and we wound up with these 5 issues: addiction and overdose. Certainly, interestingly, all of them have been affected by the pandemic pretty severely. 106,000 deaths now from overdose in this country. Violence, with homicides going up. Adolescent health, which you work on. A huge underappreciated area in public health. Environmental health, particularly climate. That might be a pretty easy one, not really seen in 1916. And the last one is the food system and obesity. And just the fact that, and of course, food and food access has been enormously important during the pandemic. So we pick these 5 areas. We bring in fellows who work on the front lines of those areas. We also give out grants, do research, do different projects. The idea is that we want to make progress in the real world. So it's, for someone who's been a health commissioner out in the real world, this is a fun job for me. It's very rewarding, and but one of the best things is to get to work with students like you.
Oh, thank you. No, and I think for me it was fascinating to meet all these different people in these different areas and think about how the work they're doing and, say, food systems might impact the work that I'm doing with adolescents. And I think there was a lot of opportunity for collaboration between the fellows and between organizations that I don't know if it was intentional from the start, but I think is really appreciated by the fellows.
Well, I'll give you an example between food systems and adolescents. There was a study that we supported that found very high levels of food insecurity among adolescents. So typically, people look at hunger or growth retardation among younger kids, not so much adolescents. But turns out in some areas there's very high food insecurity, especially where families are low income. And that has all kinds of terrible consequences for adolescents. People, who have enough to eat don't appreciate just all the consequences that come around from not having enough to eat. And not just having trouble in school, but much more likely to engage in risky activities to get money for food. And so it has influenced, in Baltimore, there are new efforts on adolescent hunger, particularly new efforts to get SNAP benefits just to the adolescents directly, not even with through their families, but other types of efforts. And I do think that there are, at the intersections of these different issues, very important things to look into.
Yeah, and there's also, in addition to the 5 focus areas, there's these cross-cutting themes that are highlighted through the initiative. So it's equity, evidence, and policy, and I think those can feel like very big, amorphous words sometimes. So I'm curious how you see them as they're put into practice, sort of what those intentions are.
Sure. Well, I think of public health as having a toolkit. And, when they created the School of Public Health, the story there, by the way, is that John Rockefeller wanted to create the first School of Public Health, and he decided it would either be at Harvard or Columbia, one of the two. And so he had a committee to advise him whether it would be at Harvard or Columbia, and he appointed as the chair of the committee the dean of the medical school at Johns Hopkins. So it was kind of like the original Dick Cheney move, you know? And before you knew it, by the end, it was at Johns Hopkins, and that dean went over and became the first public health dean at the school. But you had to define it. And the definition that they came up with was that it is not so much about the discipline, it's about the goal, the improvement of health at the community level. And so, you know, you have a toolkit of diverse tools to get to that goal. And equity, policy, evidence, those are all ways that people in public health think. We want to actually improve health. That is the true north. We want to improve health. We want to do it in an equitable way. We know also that you cannot really get to population health improvement without really looking for where there are inequities in health access and health conditions. Evidence is absolutely critical. You find what works and you scale it up. The person who came up sort of with the motto for the school, which is protecting health, saving lives, millions at a time, not the most humble motto, he identified the value of vitamin A supplementation for child survival, and was responsible for that insight, saving millions of lives. And then policy, like we said before, incredibly important to not just have the evidence. In fact, one of Dr. Sommer's most important accomplishments wasn't just figuring out. People didn't believe him when he said vitamin A supplementation would work. He had to fight to get the policy adopted, and then vitamin A supplementation has been added to all these child survival programs, and as a result, you've had the impact. So you have to go from evidence into policy in public health. So we try to teach students to think along those terms. What is the overall problem you're dealing with? Not just what you see in front of you. You know, if you had an issue with literacy, it's not just the people walking into the library who are having trouble. It's, well, what about in our community? What's the evidence on what you can do about literacy, and how do we put in place policies to fix it?
Yeah, no, I agree. And I think I appreciate you sort of defining public health a little bit, because I think it's become common parlance now, right? This idea that everyone knows what public health is, or so they think, because of the pandemic.
Apparently there are a lot of experts on Twitter.
Yeah, exactly.
Yeah.
So I was actually in my first epidemiology class when the first reports of COVID were coming out, and we were sort of talking about it in class of like, well, what is this? What can we compare this to? And it's a lot of friends were turning to me, and I was like, I'm by no means an expert in pandemics or anything, but I think that the classes gave me an insight into how to think about what was happening and how to think about where we were going next. So I'm curious if you can talk about where you think we are now in the pandemic, and where do you see us moving forward from here?
Sure. Well, I should say that I do teach a course at the School of Public Health, and I've taught it for the last 5 years, called Crisis and Response in Public Health.
And you have a book about this,
I wrote
too.
a book called The Public Health Crisis Survival Guide. And I learned during the pandemic the answer to the question. In the middle of a pandemic, if somebody writes an article in the New York Times that says you're the author of a book on the pandemic, and it like links to a page where you can buy the book, how many people buy the book? Do you want to know the answer to that question?
Yeah, I want to know how many people buy it.
43. 43 people buy. I thought, like, this is it. This is my moment. I don't know if I'm ever going to have to work again. I have a click in the New York Times. It was 43 copies. So at any rate, I taught the class, and the reason I even came up with the class before the pandemic was I felt that it's really important. I mean, I had these jobs as a state health official, a city health official at FDA. It was like crisis, 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 crisis. But you go into the school and people are like, okay, think strategically. Think about your long-term planning, you know, and that's important. But what I knew is if you can't deliver during a crisis, nobody will listen to you strategically or for your long-term planning. And so I really wanted to teach students and think about with them, you know, what good crisis response is. So I wrote this book. We studied the CDC guidelines for communications in a crisis. And sure enough, while I was teaching the class, you start seeing these reports of a new respiratory disease in China. And, you know, it was one of those things where we're like, oh, that's kind of interesting at the beginning of the term. And then by the end, we're all on Zoom, you know. And at the last class, I invited a Washington Post reporter to come. He was calling me about the pandemic. I was like, you should just come to the class. And so he came and asked the students all these questions, and they basically said, nothing Dr. Sharfstein is teaching us is happening. You know, and we went through the CDC guidelines on how to communicate during a crisis. It was like, no inappropriate humor. You know, I mean, you just think about what we were seeing on TV, but like stable, credible messengers talking about things, you know, give people, don't downplay risks. You know, like you could go through all their lists of what not to do. And in fact, the Washington Post reporter wrote the story and saying like it appears that they've just thrown the book out the window, which is kind of what they did. Mm-hmm. And we've just struggled, I think, from those early days to kind of have a sense. Now, the current definition of public health is from the Institute of Medicine's report in 1988, what we as a society do collectively. So in those words, it's like, it's a lot about doing things together and thinking mm-hmm. about the population and the whole community. Mm-hmm. It's something, interestingly, early in the pandemic, when, you know, everything was happening all at once and people were calling me in part because I'd written this book, I got called by like one of my favorite podcasts. And they said, we want to interview you. And I was like very excited to be like on the podcast. They, in the end, never aired the interview. I don't know why. But I had this long kind of really sincere and a little bit emotional interview where I kind of remember saying, I'm worried whether we can come together because the essence of succeeding in a public health challenge is what we as a society do collectively. Mm-hmm. You know, and interestingly, I wrote them like in November 2020, okay, you're not gonna air the podcast, could you send me the audio? You know, and they got back to me like a year and a half later, so we got it like a month or two ago. And we did a podcast on this, but that is exactly what I said. I said, I'm worried, I don't know whether we're gonna come together. And of course, you know, I don't think we did. I mean, mm-hmm. the podcast exacerbated polarization, people exploited the podcast, the pandemic. Mm-hmm. And particularly there was this moment where I think the Trump administration said, you know, we'll let the public health people say, close it down, and we'll say, open it up. You know, and mm-hmm. we'll kind of set...
Like pitting them against each other, yeah.
And I think that just set up a dynamic that was just really difficult. Of course, things haven't been smooth as milk since, you know, the administration's changed. There are always bumps, but it's just been really difficult. So I think of the pandemic not just in terms of like what the case count is, but how are we doing, mm-hmm. you know, mobilizing collectively. And we're still struggling. You know, I was in Atlanta a couple days ago. I flew to Atlanta under a mask mandate.
I was actually going to ask you about that.
I flew back from Atlanta to Newark. On the Atlanta to Newark flight, I would estimate 20% of the people wearing masks.
Wow.
And, you know, I think that it's unfortunate because there are definitely people who are at risk and they don't have a choice if they're going on an airplane to sit really close to people. And they may not be able to respond to a vaccine, for example. So I think it's unfortunate we don't have enough of a shared conception. So I do think from right at this moment, as an epidemiologic question, we're doing reasonably well. I think the A2 variant, the people that I speak to who are like the infectious disease experts at the School of Public Health think that because we were hit so hard by Omicron, the A1 variant, that maybe the A2 won't be so bad in this mm-hmm. country. But nobody really knows until we see it. The future probably holds more variants, variants that can escape the immune system. We're going to probably need different types of vaccines. So I think it's predictable that we'll be in this. And what you really need is trust and a community conception of like, we're in this together, we're human beings, that's the virus, we're going to fight it. So that's where I still think we have a ways to go.
So what do you think we could be doing to better build that trust? Is there a way to come out of that now or dig ourselves out of that hole?
Well, that's a good question. I think that it's most likely to happen locally, you know, where you have good relationships. And there are some places that, you know, have done very well with the pandemic. Baltimore City, the health commissioner has done a terrific job. Other places in the country, the health commissioner has been vilified. People have shot into their homes in some places. There are like marches with guns on the front lawn. I mean, it's just been horrifying. And I think, you know, this is a really pivotal moment actually, because what I teach in my crisis class is that there's a window of time for change after a crisis, where people are ready to think about how to prevent it, how to do things differently, and then that window closes. And I think we're kind of in that window, and it's going to be interesting to see what we're able to muster. out of this moment
Yeah.
to make things better. I do think a little bit more respect and protection resources for public health would be helpful. I think public health has to be, on its part, willing to create forums for more engagement. I think the perception that public health would wake up in the morning and change its mind and do something different, over a long period of time eroded some of the goodwill in some places. But I think with a more participatory public health, more respect and resources, I think that's kind of the recipe. And I don't think it will be uniform what happens across the country, but I hope that we'll get better. And I spend a lot of my time now working for that.
You were talking about a podcast that you recorded for someone else, but you also have a podcast, or the school has a podcast called Public Health on Call. And the first episode was released on March 3rd, 2020, and it was on global preparedness, misinformation, and community transition. I'd like to know more about how you guys started the podcast and sort of what unexpected results did you find from it, or did you not find from it?
I don't know. I woke up one morning and I was like, we should do a podcast. And then basically because here was a new disease, and all these people inside the School of Public Health had all these interesting thoughts about the disease. And I mean, the hallway conversations at the time, the unmasked hallway conversations, as we look back, were just so interesting. Like we have infectious disease modeling experts, virologists, policy, emergency preparedness, experts. And so it's like, we should be sharing this with people. And one day I called the dean and I was like, this is just a great idea. We'll do it for like 2 weeks, and here we are, we're like at episode 300 or 400 or something.
Yeah.
And we, at times, it's kind of crazy. We were doing 2 episodes a day. There are 15-minute interviews with different people. We're not trying to be like the most controversial, we had a great, I teach a class on the media and public health with a journalist, and today we had a class on disinformation and misinformation, and we had some FBI experts or ex-FBI experts come and talk about it, and they said, what makes things really clickable is it just enrages people. People will watch a deep fake video because it just seems cool before they will actually watch the regular video. And it's just, so I think maybe we hurt ourselves with the podcast by saying we are going to try to be a calm and stable voice of what public health thinks about different things, not just the pandemic, but also the impact of racism as a public health issue, climate change, food issues, HIV, global health. So we went from 2 episodes a day to 1 episode a day to 3 times a week with occasional bonus episodes. But we've gotten 7 million downloads. We've won a few awards. There is an audience. We get about 10 to 15,000 downloads per episode. And I get to learn a lot. It's really fun. Because I don't do all the interviews. I do maybe a third.
You do a good amount of them, though. And I think what sticks with me was around the Olympics and COVID, sort of like how do we handle that idea of like bringing these athletes together from all over the world and asking them to compete together unmasked. And I just thought it was a helpful way to think about all these different things in this time.
Yeah, it so happens that at the School of Public Health, we have the most faculty of any School of Public Health, and one of them is not only an expert in emergency preparedness and biosecurity, but is also a medalist in the Olympics in swimming, so she was a great person to do that episode.
Yeah, so I just think if you haven't listened to it, I highly recommend it.
But I will say, since we're at the library, you're with the library, I'll say some of the best episodes are book-related episodes, and we did some that I interviewed the chair of the English department about The Plague by Albert Camus.
Mm-hmm. Yeah, I remember that episode,
Which was just so relevant. I mean, more than 50 years later, to how all the denial that was going on, the anger, the way that the plague hit the poor in Algeria and what we were seeing in the United States. There was another one, Enemy of the People. I don't know if you heard that episode.
I don't remember that one.
Henrik Ibsen wrote a play, Enemy of the People, about a public health director who closes the baths. He wants to close the baths because he's worried about essentially cholera. And he's very high and mighty at the end of the first act. And then they won't close the baths and they vilify him and they call him the enemy of the people because the town relies on the baths for some economic support. His brother think is the mayor, and it becomes very, very painful. And one of the key lines in that, I think, is if you're going to stand up for people's health, don't wear your best trousers. I'm butchering the line, but it's a tough, and so relevant. So we found there was an expert in Scandinavian literature around, so we talked to him.
That's amazing. So as we were saying, my focus is on adolescent health. I'm the teen librarian here, and I work closely with the middle school and high school students in town. And something that I think we're seeing across the country, and particularly in our community, is high levels of anxiety and depression amongst teens. I know that the Center of Adolescent Health is really focused on sort of youth disconnection and students either dropping out of school or like high absence rates. I'm wondering what sort of policy you see would be either short-term, long-term, both effective for better taking care of our adolescents, particularly their mental health.
Yeah, this pandemic has been brutal for adolescents. And there are some who have really done well at home, but there are a lot that have not. And kids of all ages, including adolescents, their peers are just such an important part of their development. And it's just been extremely, extremely difficult. I'm sure all of us know kids who have struggled enormously. I think more than half of families now, parents, are concerned about their teens' well-being, and the rates of hopelessness is close to half, in some of the most recent surveys, and suicidality about a fifth. So it's really, really terrible. And, among the truths that the pandemic has exposed is what a terrible job we do for mental health of children and adolescents in this country.
And that's been existing before, like you're saying, it's not because, the pandemic hasn't helped, but it's been existing for a while, right?
Yeah, and it's the pandemic, this is, Albert Camus, it clarifies things, it exposes, it doesn't create as much as it exposes sometimes. And it has absolutely exposed this, and the treatment system is incredibly weak. There are things that can be done in policy to not only create more capacity, but also to really use telehealth much more effectively for young people who, of course, are pretty happy with their they can use gadgets for a lot of things. There are policies that, I think have to do with screening, appropriate screening, and training of people to recognize. You can actually, there's some concept called mental health first aid.
Yeah, I've taken that course, yeah.
Well, how did you find that?
I think it was eye-opening just to think about this. There's obvious signs sometimes, right? But some of the things that you wouldn't think are obvious that you can keep your eye out for, and also just language to talk to teens about things. I find that it's also, I have found most effective just being present with them. So I think for the course, that was a big part of it, right? Is just sort of being present, not being afraid to ask them questions, not feeling like you have to sidestep around issues. But I took this a while ago, very, very pre-pandemic, so I'm not sure if they've updated anything since then.
I think too much, this goes back to the point about public health being about the community and populations. Too much we think about teens through the lens of the individual, in the sense that it's like, whatever's going on is probably that kid's fault. We don't think about that for other health challenges necessarily. We think about what's the environmental reason why there's a problem with this particular person, or what could be going wrong that we as a society can help fix. But the bad kids narrative sometimes, or something went wrong in their house or something like that. And that's just the wrong way to think about it. Like, this is affecting so many kids at such a level. We need broader solutions. And, that's why you have the Surgeon General's advisory, why people are calling this, a national emergency. And it's really important to rise to this challenge and to see what's happened. And this is one of the areas where this post-pandemic period for things to be taken seriously is it's important for this to be high on the agenda.
Yeah, and I think something that I really appreciate about what I get to do at the library is that it's a community-based thing. I talk to kids one-on-one, but for the most part, I'm dealing with 40 to 50 teens at one time, and thinking about the teens that aren't coming in, and working with the schools closely if I do notice something about an individual or about a group of teens.
I will say that after Emily came to the School of Public Health, some of our faculty decided to do some public health work in libraries. So there's a lot that can be done. Kids trust libraries. it's a safe place for them a lot of times, where there may not be in other parts of their lives. And, it's just so much more than a place to get books. Books would be great alone.
Yeah,
It's like
yeah.
Dayenu, but like it does more. It can be a place where kids can come and find support of different kinds. And so I think it's great. One reason why we're proud of trained you is to think in those terms.
Yeah, no, and I think our phrase is we're free and open for all, and I think to me it's really important that we say that that's for everyone, really. It's not, we always think about kids in the library doing story time, we think about adults in the library using computers or books, but it's about the teens too, and I feel very fortunate that the teens do come to the library here, and we're right across the street from the school. And
one thing that is a challenge with adolescents is, like a baby will cry. There's only so many things a baby does to indicate its wants and needs. And teenagers are kind of similar. Like there's certain things they do and they'll act out. But oftentimes they're punished instead of helped. And that happens at the school. It happens in different settings. You can't come back here. And that just pushes them further and further away.
yeah,
And I think, recognizing a lot of those things are cries for help and trying to find a different kind of response is really important, and looking past different prejudices that people have, particularly with certain teenagers, is really important to be able to be open to helping them.
Yeah, yeah. I'd like to ask, I think I have 2 more questions, and I'm happy to open it up if anyone has any other questions. How do you think COVID has affected population health, both short-term and long-term? So obviously not just about sort of COVID and its direct effects, but all those other sort of domino effects of the pandemic.
Yeah, not good. Yeah, not good. I mean, it's not just nearly 1 million people dying of COVID, it's people not getting health care for other things, but the mental health challenges have just been enormous, and the grief that people are going through. That's why we have more overdoses than we've ever had in this country, why homicides are going up. It is the aftershocks of so many people dying and such disruption, socially, economically, and personally. It's been a miserable experience. And you can just see it from so many different angles. So the long-term impact is, and obviously the challenges for kids in school, it could cast a long shadow. But I don't think that chapter has been fully written. And it really partly depends on whether we can learn some lessons from this. I'm working on different commissions and reports and trying to find different ways to get in. I'll say I don't want to be totally gloom and doom here, but we at least for a while had a child tax credit that really lifted a lot of kids out of poverty. Maybe we'll get that back sometime. There are certain things that we were able to do during the pandemic that were completely, off the radar screen before. And crises do create that clarifying, opportunities. And so I hope we still have a little bit within us to take advantage of that.
And that's actually perfect to my last question of thinking about how public health has again become common parlance. And it's really an opportunity for the field, right, to mobilize on some of these other things that we've been working on quietly for decades, right? So this is sort of a 2-part question, but sort of what initiatives do you see great opportunity for moving forward and importance for moving forward right now? And also, how do you suggest people get involved in public health, the general community? How do they get involved?
Well, I think it really depends on what people want to take on. There's so many important issues, and there are different ways to be involved. Now, I think, have a county health department.
We have a local health department. Actually, I don't know if our local health officer is here, Candace Davenport. She's been phenomenal during the pandemic, as always, but particularly right now, she's been really amazing.
Well, that's fantastic. It's really important. So maybe that's the best question directed for her in terms of how, people can get involved. But it doesn't always have to be through the health department. It can be through the library. It can be through other areas. It's what I would say to medical students who are interested in, they come to me I'm kind of interested in, housing, but I don't know what to do. I know housing is a big issue, but I don't know what to do. Or I'm really interested in nutrition, but I don't know what to do. I would say to them okay, look, if there's somebody comes in with a rash, you're going to spend all your time on the computer finding that rash. So in the morning, you know, or if you can't figure it out, you'll call a dermatologist, you'll ask. You'll just keep searching until you get answers for things. When you see something that's wrong with the patient, that's what you do. If you see something that's wrong with the world, you just have to have the same attitude. Figure it out. You know, keep working, call people who know better. When I was a pediatric resident, we did get very concerned about the impact of housing on children. I remember taking care of a kid who was overweight and just so sweet, but like couldn't really walk because he was in a stroller the whole time. No exercise. And I said to the mom, you know, he's got to walk around. I mean, what's going on? And she said, well, we're living doubled up in an apartment in Boston, and the people we're staying with don't want him running around. And so we'll be homeless if he runs around. So I have to keep him strapped in all day long.
Wow. Yeah.
You know, and so we figured out how to help get them a different apartment, you know, and you know, what kind of support she needed. And we called it a medical emergency because it was for this child. And we wound up doing, you know, learning the housing code, learning what landlords have to do, you know, and that became like a big push for us. And whenever, whatever issue, you know, I think about it, it's like, look, you can start whether you recognize something's wrong, and then you just keep digging and you just keep calling people until you learn more and you figure out where you can have an impact.
Well, it's that upstream mentality too, right? Of like, there's an immediate problem, but what's causing that to start, right? I think that's a really helpful way to think about public health. And I want to thank you so much for being here and for having this conversation. And I want to know if anyone from the audience has any questions for Dr. Sharfstein or for myself.
Focus area you guys had. I was curious if in any of those areas there was ever any examples that you kind of found of public health personnel reaching out to non-health related entities, you know, for environmental health, one reaching out to local energy, you know, sector type of thing, or food, you know, the food security one reaching out to food producers or something. Have you ever seen any examples of that?
Yeah, absolutely. That is what we are trying to do with this effort. We actually are looking for people who want to get public health degrees from those sectors. You know, we have, on violence, we have community activists, we have police officers getting degrees. We have people inside the food world. We have people who do work with energy companies. I don't know exactly if I can name their organizations. We're up to now, pretty soon, with our next announcement, we'll be up to 280 fellows and about 250 organizations, and we're growing by 60 every year. And so that is the idea. I think, you know, public health tools and sensibilities are really effective. They can be helpful to other fields. We learn from other fields, and the goal is to find people who are able to apply them to the challenges that they're facing. So I'm trying to think if there's like a particularly, you know, we've had a number of those companies. What we do with the initiative is when an organization sends someone to be a fellow, like the library, we try to work with the organization itself. About half of our fellows are kind of from non-traditional public health organizations, so we'll have food companies coming to our conferences, meeting with others, or, you know, trying to figure out whether there are projects that we can work on together.
Are there any areas that you feel like the initiative hasn't tapped yet, like any industries or like organizations that you guys would really love to have as part of the fellowship?
You know, I do think that is a question that now we're like 5 years old, you know. We are focusing on a little bit more. We're probably going to recruit in particular from particular areas where we're spending a lot of time in the policy area. People working on energy and climate, I think, will be important for us. But really, it's americanhealth.ja2.edu. There's just so much on the website, all the different projects. People can see whether it might be of interest to them. And 90% of our students do it part-time, so you can keep doing your job like you.
Yes.
Sort of a strange question. Tomorrow in New Jersey, we're starting the sale of adult use cannabis.
That's why Emily said she wanted to get this.
Yeah, no, I know you wanted to see it, yeah. And they're starting to line up now if you're interested, stick around. Do you have any suggestions on how those of us who are in the public sector should be talking to people about this, particularly young people?
So, you know, I have mixed views on this topic. I think the drug war has been really horrible, had all kinds of negative consequences for people in communities, in particular minority communities. At the same time, marijuana is not a vitamin. You know, it can have some very serious consequences, particularly for young people. And I think as a pediatrician about the developmental trajectory that kids need to be on. Like, we want kids to fly. You know, we want kids to do what they want to do in their lives. And there are certain things that can knock them off that trajectory. And, you know, a problem with marijuana is absolutely one of them. And not just because it probably can precipitate psychotic episodes or lead kids to just really focus on marijuana. Again, of course, it's not everybody, but there is a percentage of kids who get into trouble, and young people. And so I think that treating it like a vitamin or just like something that's fun is a real danger. And particularly, I don't know the details of the law here. In some places, it's, you know, there are basically companies that are able to market it in all kinds of ways. I think that probably there will be a number of people who are harmed from that side of things. So I think somewhere out there is a middle ground, you know, that kind of doesn't have the consequences of criminalization, but on the other hand, doesn't have the consequences of kind of mass commercialization. And, you know, I hope New Jersey finds that spot as quickly as possible, but it's very challenging. When I was the health secretary, there were advocates. At that time, it was about medical marijuana in Maryland, and you know, I took the position which I described as the yellow light position. I said some people have the green light, some people have the red light. I like the yellow light, which was basically like I wanted to see some evidence, you know, before I said that it was a good idea for people to use marijuana for a particular problem. Like, there should be some evidence for that. And people were so upset. My brother called me and said, I don't know what you're doing, but you're ruining the family name on Twitter. You know? And I went to one hearing with all these people behind me who were all in favor of, you know, marijuana for this or marijuana for that. And one of the members of the state legislature said, so Dr. Sharfstein, look around the room, you think these people are all lying? That they weren't cured or helped incredibly for all these different conditions? And of course, I had worked at the Food and Drug Administration, and I responded something like, look, if, you know, when I worked at the Food and Drug Administration, we had a name for the day when people showed up and said they tried something and it made them better. And that name was Monday, also Tuesday, Wednesday, Thursday, and Friday. You know, people can try something, they think it, you know, but we want evidence to know whether something really works for something. And so if you take a thoughtful approach to marijuana, you're trying to find that yellow light, in my opinion. Just an immense stress, even under the best of circumstances. And they're really unsung heroes. So I hope you all, it sounds like you do recognize that, but it's just incredibly hard. The federal government had multiple problems. It was not just that they threw out the CDC guide. You know, the federal government is very disorganized at times when it comes to health. There are these different agencies that do their own thing and sometimes overlap for different reasons, not all their fault. We have desperately underfunded public health for many years in this country, so we were going into battle with a very weak, you know, set of ships or whatever. You know, we were not sailing with ships that could really sail. And you combine that with throwing out the book, you know, on communications and not using the plans, and it was just absolutely terrible. So I think that we can't count on just a different administration, just it all working. I'm part of a group, I'm the staff, one of the staff of a commission that was created by the Commonwealth Fund in New York called the Commonwealth Fund Commission on a National Public Health System. And the premise of that work is we need at the national level the ability to respond, not just to severe emergencies like the pandemic, but to problems that are taking all kinds of potential away from people in this country, like overdose. We have to have a response capacity that is coherent, where we're using appropriately the power of the federal government, we're working clearly with states and localities, people are able to deliver all the way through and we can see results. That is really what some other countries have. And it's why they have been much more successful in the pandemic. And by the way, they're more successful on things like opioids and overdose. And so, to me, that is a critical question. Will we learn that lesson? Will we move towards saying it's just like this kind of anarchy or chaos that we have a little bit with public health, where there really isn't a national system? Are we going to allow that to happen? Or are we going to see the value in coming together? So that's where, I'm spending time today from my hotel room in Summit on call after call, trying to see how we can put together a compelling case. But of course, it's not just enough to have a report. People have to want to think about it that way. And we may have a window of time this year to do that I think we have to take advantage of.
Well, I think we're at about time, so I just want to thank you so much again for being here and for accepting me into the public health program so that we could do this.
Well, I had an idea that an invitation to the Maplewood Ideas Festival might come. But at any rate, I really appreciate, it is just phenomenal to have you in the program and really encourage people to think about it for themselves. But I think we will think of this as when public health and libraries came together. And there's just an enormous amount of upside for that.
Awesome. Well, thank you so much, and thank you all so much for coming. And I hope you will join us. I believe our next program is next Monday, right? So we will be here at 7 p.m., and we hope you'll be there. Thank you.